Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having some trouble managing my medications. I'm nearly out of several important ones like losartan and metoprolol. It's been a bit chaotic with all the adjustments, especially with my insulin. I had a few scary moments of hypoglycemia recently.
I see you've had some challenges. Let's make sure we get all your medications refilled promptly. Tell me more about these episodes of hypoglycemia. How are you feeling now?
Well, just last week, my sugar dropped to about 41 milligrams per deciliters in the middle of the night. It was frightening. I've been adjusting the insulin doses as we discussed, but it's been tough. My morning levels are better now, generally between 115 to 170 milligram, but the nighttime is unpredictable.
That sounds quite concerning. We need to look closely at your insulin regimen and perhaps make some more adjustments. How about your exercise and diet? Are you able to maintain regular activities?
I try to walk daily, but I can't go far without feeling breathless and tight in my chest. I barely make it a block before I need to stop. It's frustrating because I want to stay active to help manage my diabetes and heart health.
It's good that you're trying to stay active, but we need to address this breathlessness. You mentioned a nuclear stress test was done in January. We'll review those results today. Any other symptoms, like chest pain or more breathlessness when you're resting?
No chest pains, thankfully. Just this annoying tightness, and sometimes it feels like I can't catch my breath after even a little effort. My blood pressure has been better since adjusting the meds, though.
Good to hear your blood pressure is stabilizing. Now, regarding your kidneys, you mentioned a transplant evaluation. How is that going?
The doctors are evaluating my case for a transplant. I have a potential donor, and we have a meeting scheduled with the transplant team next week. My fistula was put in place a while back, but it's never been used.
That's a significant step forward. Managing your CKD alongside your other conditions is crucial. We'll continue monitoring your renal function closely. How are your other symptoms like the reflux?
The GERD isn't too bad lately. The omeprazole seems to help, but I make sure to follow the diet guidelines we talked about, avoiding spicy and fatty foods. My eyes are stable too. No new issues with the glaucoma or cataracts, and I'm keeping up with the eye drops.
That's excellent. Staying compliant with your treatments is key. Now, let's go over some of the clinical values from your recent tests to get a clearer picture of how to proceed. Your random glucose today was 190 milligrams per deciliters, which is on the high side. Your hemoglobin A1C is 7.2%, indicating that we need to keep a close watch on your diabetes management.
I understand. It's been a lot to keep track of, but I'm committed to getting better control over my health.
I'm glad to hear that determination. Your average blood pressure over the last week was 135/85 millimeter Hg, with peaks around 155/90 millimeter Hg. Your lipid panel shows your total cholesterol at 188 milligrams per deciliter, with LDL at 110 milligram and HDL at 48 milligrams per deciliter. Your triglycerides are 150 milligrams per deciliter. These are within reasonable limits, but we'll keep monitoring them.
Sounds like we're on the right track with the heart and cholesterol.
Yes, and your renal tests show your serum creatinine is currently at 1.9 milligrams per deciliter, with an estimated GFR of 35 milliliters per mins per 1.73 ml, which is consistent with your CKD stage. We'll need to keep a close eye on this, especially as we approach the possibility of a transplant.
I appreciate all your help, Doctor. It's a lot, but I feel better knowing we're keeping track of everything.
Absolutely. Here's the plan. We'll adjust your insulin to try and stabilize your nighttime glucose levels to prevent hypoglycemia. We'll refill all your medications today and schedule a follow-up appointment with cardiology to review your stress test results. Any concerns or symptoms, you should contact us immediately.
Thank you, Doctor. I will follow up on everything and keep you updated.
Great. We'll see you back here in 3 months for a routine follow-up unless something comes up sooner. Take care and remember to reach out if you need anything before then.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Doctor. I've been feeling quite unwell for a while, and I've been really worried about some of my symptoms.
Good morning. I'm sorry to hear you're feeling unwell. Let's go through your symptoms one by one so I can get a clear picture of what's been happening.
Well, where should I start? This summer has been tough. I started feeling ill and just haven't bounced back. I even had to cancel some specialist appointments because they just keep repeating the same tests with no new answers.
I see. It sounds frustrating. What symptoms have been most troubling for you?
The most persistent issue has been this intermittent lower abdominal pain. It's sharp, especially on the right side, and intense enough at times that it stops me from moving much. It often happens after I've been to the restroom or when I get up from sitting.
Does anything seem to trigger the pain, other than the movements you mentioned? Any relation to food or activities?
Not really related to food, but it's definitely worse when I'm active. Speaking of active, I've taken up yoga and other exercises which seem to have helped with some other minor symptoms, but not with the abdominal pain.
It's good to hear that some activities are helping. You mentioned also having some issues with headaches.
Yes, I had these quick, intense headaches, but they've mostly gone away now. No idea why they started or why they stopped.
And how about the moles you've noticed on your face?
Oh, those. They're hard and white, not painful, but they feel rough. They just popped up out of nowhere.
Thank you for sharing all of that. I'll make a note of these details. How about your overall activity levels?
I've been trying to keep active despite the pain. I do some yoga, swimming, and biking when I feel up to it.
That's excellent. Staying active is important, but we also need to listen to our body's signals. You mentioned concerns about your blood pressure too?
Yes, I've noticed some unusual readings. For instance, at a recent dental appointment, it was 106/88, which is odd for me.
Thank you for that detail. It's helpful. Have you continued monitoring your blood pressure at home?
Yes, I try to keep track regularly. And there's another thing. I stopped taking omeprazole and have been managing my diet to help with my stomach. I haven't felt much gastrointestinal discomfort lately.
That's a positive step. Managing diet can significantly affect your gastrointestinal health. Now, regarding your medication for cholesterol, you mentioned there were some issues.
Yes, I need a renewal on my prescription. I've been quite active in managing my diet and exercise to help control my cholesterol levels.
We'll definitely sort that out. Have you had any follow-up on the bladder infection you mentioned earlier?
That was over the summer. It's cleared up, but it made me feel quite unwell at the onset, along with the other issues.
I understand. Let's ensure we address all these points comprehensively. We'll start with collecting a urine sample to check for any underlying issues, especially to help explain your abdominal pain. Depending on those results, we might consider further imaging, like a CAT scan.
That sounds thorough. What about the moles? Should I be concerned?
We can refer you to a dermatologist to get those checked out. It's good to be cautious with any new skin changes.
And the cholesterol medication?
I'll extend your prescription today. Continuing your medication without interruption is important for managing your cholesterol effectively.
Thank you, doctor. It feels good to be taking steps to figure all this out.
Absolutely. I'm glad to help. We'll start with the tests and go from there. Keep up with the exercise as much as comfortable, and we'll reassess after we have more information from the tests. I'll also arrange for you to follow up in our women's health clinic for routine screenings and to address any gynecological concerns.
Thanks, doctor. I appreciate your help.
You're welcome. Let's get you started on those tests and ensure you have all the support you need. We'll touch base soon once we have the results.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Good morning. How have you been feeling since our last consultation? Any improvements or new symptoms?
Morning, doctor. Unfortunately, I've been feeling a bit worse. My cough has gotten more persistent, and I've been feeling very tired.
I'm sorry to hear that. Have you been taking the medication as prescribed? Also, have you monitored your temperature?
Yes, I've been following the prescription closely, and my temperature has been slightly elevated the past couple of days.
Thank you for updating me. Based on what you've described, I'd like to adjust your medication. I'll also recommend a chest X-ray to rule out any complications. We'll need to monitor your symptoms closely.
I understand. Should I continue with the current medication until then?
Yes, please do. But let's add an inhaler to help with your breathing until we get the results from your X-ray. I want you to use it twice a day and keep track of any changes in your symptoms.
Okay, doctor, I'll start using the inhaler and keep a symptom diary. Should we schedule another appointment now?
Yes, let's schedule a follow-up for next week. I'll send you a link to book a time that suits you. Meanwhile, if your symptoms worsen or you experience any other concerns, please contact me immediately.
Now look at question 26.
Today, I want to talk about the benefits of complementary chiropractic care, especially when integrated with traditional medical treatments. Chiropractic care focuses on disorders of the musculoskeletal system and the nervous system, and their effects on general health. Studies show that integrating chiropractic adjustments can significantly enhance orthopedic care, pain management, and even post-surgical recovery. It's a holistic approach that emphasizes the body's potential to heal itself. For example, patients with chronic lower back pain may benefit greatly from chiropractic services in conjunction with physical therapy. This approach can help reduce dependence on pain medications and improve overall mobility. Let's discuss how chiropractic care works with the body's own healing mechanisms. By adjusting the spine, chiropractors stimulate the nervous system to restore function and support the body's natural healing process. Are there any questions so far? I would be happy to delve deeper into any of the points we've covered, or discuss how chiropractic care can be tailored to individual health needs.
Now look at question 27.
Let's start today's session by practicing some of the vocal exercises we discussed last week. How have you been managing with the teeth sound?
It's been challenging, but I've been practicing every day. Sometimes I get it right, sometimes I don't.
That's perfectly okay. It's all about practice. Let's try a few exercises together now. Repeat after me. 3 thin trees.
3 thin trees.
Great progress. I can hear the improvement. Let's keep practicing this sound with different words.
Now, let's move on to a more challenging sentence. Try saying, the 33 thieves thought they thrilled the throne throughout Thursday. Take your time and focus on each word.
The 33 thieves thought they thrilled the throne throughout Thursday.
Excellent. I see significant improvement in your pronunciation. Remember, regular practice is key to overcoming speech difficulties. Shall we try a few more sentences?
Now look at question 28.
Addiction is not just a personal struggle. It impacts families, friends, and communities. Today, we'll explore the challenges of addiction, including the biological, psychological, and social factors. One case study involves a young man who struggled with alcohol addiction for over a decade. His journey to recovery was marked by multiple relapses, which is common. Understanding these patterns can help us develop more effective treatment plans. It's crucial to address not only the physical symptoms of addiction, but also the emotional and mental health issues. This comprehensive approach can significantly improve outcomes. Does anyone have questions on this? Additionally, let's talk about the importance of support systems and community resources in recovery. These networks can provide essential support during the recovery process, helping individuals maintain sobriety and rebuild their lives. Finally, if there are no further questions, I'll conclude today's presentation by emphasizing the need for personalized treatment plans. Each person's journey is unique, and so must be the approach to their recovery.
Now look at question 29.
I have your X-ray results here. It looks like there's a small fracture on your left rib. It's what's likely been causing your pain.
Oh, I see. Is it serious?
It's a clean break and should heal with proper care. I recommend rest and avoiding heavy lifting. We'll schedule a follow-up in 6 weeks to monitor your progression.
Thank you for explaining that. What should I do if the pain increases?
If the pain becomes more severe, or if you experience difficulty breathing, you should contact us immediately. Meanwhile, I'll prescribe some pain medication to manage discomfort. It's important to follow the dosage instructions closely.
I appreciate your help. Will this affect my daily activities significantly?
It's crucial to avoid strenuous activities that might stress the fractured area. However, you should be able to continue most of your daily routines with some minor adjustments.
Now look at question 30.
Good evening, everyone. Today's workshop is focused on family planning, an essential topic that impacts both individuals and families in significant ways. Though often not openly discussed due to cultural and personal reasons, family planning is vital for ensuring the health and well-being of families. We'll cover various methods of contraception, discuss their effectiveness, and address common myths. It's important to make informed decisions that align with your health, lifestyle, and family goals. I encourage you to ask questions as we go along. Let's start by discussing the most commonly used methods and their benefits, shall we? Additionally, we'll discuss how family planning can be a part of long-term health care and how it contributes to the empowerment of individuals, especially women. Understanding these aspects can help in making informed, responsible decisions. If there are no immediate questions, let's dive into the details of each contraceptive method, starting with hormonal options like the pill and IUDs, and then moving on to barrier methods and natural family planning techniques.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Today we delve into a complex topic regarding the management of infective endocarditis, particularly focusing on the POET trial, which investigated the efficacy of partial oral versus intravenous antibiotic therapy. Joining me today is Dr. Henry Gold, a specialist in infectious diseases with a keen interest in endocarditis. Thank you for joining us, Dr. Gold.
Thank you for having me. It's great to be here to discuss such an important topic.
Infective endocarditis is a severe condition characterized by the infection of the inner heart lining, often involving the heart valves. Traditionally, treatment has been predominantly intravenous antibiotics, but the POET trial offers a potential shift in this paradigm. Dr. Gold, could you start by giving us an overview of infective endocarditis?
Certainly. Infective endocarditis is a rare, life-threatening condition, usually caused by bacteria that enter the bloodstream and settle in the heart lining, a heart valve or a blood vessel. While it's rare, the mortality rates remain high, around 20% in hospitalized patients. The symptoms vary, but often include fever, chills, heart murmurs, and in more severe cases, can lead to strokes or organ damage due to emboli.
That's quite serious. Now onto the POET trial, which has been a pivotal study in this field. Can you explain the design and key findings of this trial?
Yes, the POET trial was a multi-center, open-label, non-inferiority trial conducted in Denmark. It aimed to compare the outcomes of partial oral antibiotic therapy to the traditional intravenous therapy after initial stabilization with IV antibiotics. Key findings suggested that for select patients, switching to oral antibiotics did not result in worse outcomes compared to those who continued with IV therapy. This was measured through a composite endpoint including mortality, unplanned cardiac surgery, embolic events, and recurrence of bacteremia.
That sounds promising, especially considering the potential benefits of oral therapy. Could you elaborate on those?
Sure. Oral therapy can significantly enhance the quality of life for patients. It often means shorter hospital stays, reduced healthcare costs, and the comfort of being at home, which is particularly advantageous for recovery. However, it's important to highlight that this approach is not suitable for all patients, but can be an excellent option for stable patients who meet specific criteria.
Let's discuss a relevant case that illustrates these points. We had a 45-year-old male patient with a history of intravenous drug use, diagnosed with infective endocarditis of the tricuspid valve. After stabilization with IV antibiotics, we considered switching to oral therapy. Dr. Gold, can you walk us through the decision-making process in this scenario?
In this patient's case, after the initial aggressive treatment, and once we observed clinical stability, marked by the resolution of fevers and improvement in blood markers, we reviewed the possibility of switching to oral antibiotics. The patient's organisms were sensitive to the antibiotics chosen for oral therapy, and he demonstrated good compliance with treatment protocols in the hospital. We also ensured close outpatient follow-up. Fortunately, the patient responded well to the oral regimen, with no complications during the follow-up period.
That's a good outcome. It emphasizes the importance of individualized patient care and close monitoring. Dr. Gold, in light of the POET trial, how do you see the management of infective endocarditis evolving?
The management of infective endocarditis is likely to become more personalized. While IV antibiotics will remain the cornerstone for severe cases, for stable and low-risk patients, oral therapy could become more common, guided by clinical trials like POET. It's also vital to continue research to identify which patients are best suited for oral therapy and to ensure that the oral regimens are as effective and safe as possible.
Thank you, Dr. Gold, for such insightful discussion. It's clear that while the POET trial offers promising directions, careful selection and monitoring of patients are key to the success of oral therapy in infective endocarditis.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, we will delve deeply into the management of venous thromboembolism, VTE, in cancer patients, integrating recent research from Harvard Medical School and practical insights from clinical cases. We will start with a recent patient case to illustrate the complexities involved. Recently, Mrs. Thompson, a 62-year-old female with newly diagnosed ovarian cancer, was referred to our clinic for oncology consultation. Post-surgery, during her first cycle of chemotherapy, she experienced significant leg swelling and pain. An ultrasound confirmed the presence of a deep vein thrombosis, DVT. This case typifies the dual risk of thrombosis and bleeding in cancer patients, making management particularly challenging. Cancer-associated thrombosis, CAT, remains a leading cause of morbidity and mortality among cancer patients, with VTE incidence rates substantially higher in this group compared to the non-cancer population. This elevated risk is multifactorial. Malignancy itself promotes a hypercoagulable state, while treatments such as surgery, chemotherapy, and hormonal therapies further exacerbate this risk. Understanding the pathophysiology, it's clear that cancer cells by their nature produce procoagulant and pro-inflammatory substances. These include tissue factor, cancer procoagulant, and cytokines, which activate the coagulation cascade. Furthermore, patient immobility, central venous catheters, and the cancer's local effects, such as compression and invasion of blood vessels, contribute to VTE risk. Harvard's research emphasizes the significance of identifying high-risk patients for prophylactic interventions. Tools like the Corona score are pivotal for assessing VTE risk in cancer patients. This scoring system incorporates cancer site, platelet count, hemoglobin level, leukocyte count, and body mass index. Patients like Mrs. Thompson, with a high Corona score, would benefit from prophylactic anticoagulation. Recent studies from Harvard underscore the efficacy and safety of direct oral anticoagulants, DOACs, in cancer patients. The Hokusai VTE cancer trial, for instance, compared edoxaban with dalteparin, showing that edoxaban was non-inferior in preventing recurrent VTE. However, it did note a higher risk of bleeding, particularly in gastrointestinal and urogenital cancers. This necessitates a balanced discussion on the risks and benefits of anticoagulation therapy in each individual case. In managing Mrs. Thompson, her elevated risk made the decision to initiate prophylactic anticoagulation straightforward, opting for a low molecular weight heparin based on her individual bleeding risk and renal function. For ongoing management, regular reassessment of both thrombotic and bleeding risks is crucial, adjusting her anticoagulation therapy accordingly. This case underlines the importance of a holistic approach in the management of cancer-associated thrombosis, considering both the thrombotic and bleeding risks. It's essential for clinicians to stay informed of the latest research and guidelines, tailoring prevention and treatment strategies to each patient's specific risk profile. The management of VTE in cancer patients is a prime example of the complexity of oncology care, requiring a nuanced understanding of the interplay between cancer biology, patient factors, and treatment effects. Effective management hinges on a proactive, personalized approach to risk assessment and therapeutic decision-making. As research advances, our strategies will continue to evolve, improving patient outcomes in this challenging area of cancer care.